what is the relationship between pollen and pollution, and how does this affect how you account for personalized tracking? You sort of touched on this a little bit. Maybe you can expand a bit more about what we know about the relationship between the two.
Sure, and again, I think this is a fundamental reason Daily Breath is somewhat unique is I felt that it's the convergence of weather, pollution, and pollen that impacts an individual. It's not those particular exposures in isolation. And so, to be frank, we don't know a lot of information because we haven't been measuring it, right? You can't manage what you don't measure, right? And so I do think that's where there's a lot of opportunity. And I do see, in academic areas, academic research, people exploring, what's the impact of CO2, increased levels of CO2 on a community or a particular type of pollen. I know of studies in Detroit around ragweed. I know of studies in Texas around mountain cedar, and they're looking at these types of dynamics. So I think what's interesting from a standpoint of the mobile health app or the digital health solution is that, now we start to aggregate more volumes of data. We know more information about, what is the experience of asthma sufferers in relation to these different types of pollution and pollen variables. And this information can really support, the research community in kind of beginning to understand what are these specific correlations. Because I just think, again, we don't have enough data. And that's really where this is an exciting time, because you use the code words of AI and big data, but the reality is that's what's enabling all of this, right? It's the ability to aggregate all of this data. It's the ability to apply machine learning to the data and really come up with more information that's helpful both for the patients and the provision of care to those patients, but also for the community at large.
Yeah, and what I see is it's really helping to accelerate the awareness around this, because even when I speak to some of the healthcare and life sciences companies in the allergy space, they're very interested in pollen data, but they don't often look at pollution, right? They think, okay, pollen is what affects. Obviously, if you have asthma, I think that's well documented, well known, and asthmatics, COPD sufferers know that both pollen and pollution is going to affect them. But I think people with seasonal allergies are less aware of that interplay. And the fact that, that there's already proof that carbon monoxide directly affects, intensifies, as you said, or triggers more pollen. So being aware of pollution levels as somebody who suffers from allergies is something really, really critical, because it's going to, again, help better inform you on your exposure, help you better plan for your daily life and being able to avoid that.